Mr. Nixon Joseph, CEO, Children's Love Castles Trust. Mr. Nixon is the former president and chief operating officer, SBI Foundation. He is a postgraduate in English literature, language and literature, joined State Bank of India in 1985 as a probationary officer. As a career banker, he has extensive experience in various facets of banking, like corporate credit, retail operations, international banking, etc. He has worked all across India. And he was also the manager operations of SBI Bahrain and chief executive officer of SBI Tokyo branch. He is a certified credit professional, certified banking compliance professional, and a certified information systems banker. He was president of the Sakura Toastmasters Club Tokyo and also started the Tokyo Debating Society. As coordinator of SBI Youth for India Fellowship Program, he was instrumental in inspiring and mentoring 100 youths every year and has taken fellowship to a higher level. He has been mentoring many social entrepreneur units started by SBI Youth for India Fellows. He has completed the social intrapreneurship course of Ashoka Changemakers with distinction. And as president of SBI Foundation, he's the CSR arm of State Bank of India. He has been supporting strong impact projects to help the underprivileged and the needy. He has been a regular speaker in various CSR forums all across India. And he is the recipient of Dr. APJ Abdul Kalam Award 2018 for Excellence in Public Service and Dr. Kalam Memorial Ignited Minds Award. His name figures in the Inspiration book released by Rotary Club, Mumbai, where 45 inspiring Indians were listed. We are proud to have you with us, sir. Over to you for your session.
Thank you. Thank you very much for that introduction. And it's a matter of great honor that I have been invited for this Global Sustainable Development Summit 2021. It's a very relevant topic, especially when it is connected to SDG3. Because health is the most important thing for an individual to have, and in turn the nation. So unless the individuals are healthy, the nation also won't be healthy. And all other goals can be achieved only if there are healthy citizens. So there is a lot of importance to be attached to SDG3. And if we see the topic itself, that is development of sustainable health infrastructure under CSR, under corporate social responsibility. It shows that corporate social responsibility should not only be directed towards health, but it should also be directed to sustainable health projects. If we see in India, corporate social responsibility was made mandatory in 2014. And India was one of the first countries to make it mandatory, only because the government felt that there is an important role for the private sector to play in addressing the development challenges. India, as we all know, a lot of development challenges, and health is one of them. During COVID pandemic, we have seen how the health infrastructure was stressed too much and the fault lines were exposed. Mahatma Gandhi had told that there is enough in the planet for everyone's needs, but not for everyone's greed. It means that we have resources. If we use it properly and prudently, there are resources to take care of everyone's need. In short, it means that even such an issue like health can be addressed properly if everyone cooperates, collaborates, and there is a lot of thought process on how the available resources can be used towards bettering the health infrastructure in India. Also, whatever developments we have should be sustainable, should not be one-off. And here, the importance of corporate social responsibility comes into play. All of us know the benefits a corporate gains by being a responsible corporate. by being responsible to all the stakeholders. And therefore, we find after this amendment has come in India, many of the corporates have begun to implement CSR activities quite genuinely, quite passionately. The healthcare sector in India, as we all of us know, is an ailing sector, I should tell. And the pandemic has just exposed the fault lines. I understand that the government expenditure on healthcare is around 1.5% of the GDP, whereas it is a very a high percentage in all other countries. So we have a lot to go to be on parity with other countries. All of us know that maternal infant mortality rate is very high. Life expectancy, though it has increased substantially, it is still low compared to many other countries. The primary healthcare system is completely, I would say, stressed. And secondary, tertiary level hospitals are mostly in the private sector. So if any common citizen were to get afflicted by any disease or any health issue, the strain on the family income, strain on his income is too much, because he will have to go to private sector to get enough proper treatment. Mainly because our government hospitals are not, the hospitals in the public sector are not like the government schools available, are not able to provide the kind of care, health care to be given to people. So in India, we have the government hospitals taking care of almost 20 to 25% of the requirement, then remaining by the private hospitals. In spite of the introduction of the health insurance scheme, all these also, we find that COVID itself has demonstrated that we have a lot to do as far as health infrastructure is concerned. And a lot we have to do, because this is not statistics. When we hear daily that so many people, in 300 or 400 people have died due to COVID, or people are struggling to get oxygen. All these are not statistics. These are issues which are affecting someone, some life. They are brothers, they are sisters, they are mothers, they are fathers. In fact, these are not statistical data. These are issues which should concern everyone primarily. I would tell that it is the primary duty of government to see that its citizens' health issues are taken care of. But then, as we see, the government has a lot to issues to be addressed, and therefore we cannot leave everything to the government. It is here that facilities like corporate social responsibility and all should rise to the occasion and support the government and initiate projects in a public-private participation mode. During the COVID time, we find that many of the corporates have risen to the occasion. Like we find that be it a supply of medical equipments, be it equipments like N95 masks or PPE kits or ventilators, in all these requirements which the healthcare sector requires, all these to a great extent have been provided by the corporates. In that way, the corporate social responsibility amendment, which was brought by the government, came fully into play. And I should tell that the corporates really opened the tap and cooperated with, rose to the occasion and came to the help of the people. In that way, the corporate social responsibility has been done well during the pandemic time. And also the government made it easy in one way, that temporary healthcare structures for COVID relief or any activity which is related to COVID relief would be considered as corporate social responsibility, or eligible to be considered as corporate social responsibility. So that also became an added incentive for corporates to support the healthcare system. And therefore, what we have found is that the capacity of many hospitals have increased. Like many of the corporates have supported in installation of ICU beds, or setting up of ICU rooms, or even ordinary beds. All these things I find corporates have given their help by way of CSR activities. But then there is a lot to be done. There is poor, all of us know, poor infrastructure. Corporate social responsibility, like CSR activities, should be designed in such a way that we can address much of the ails in the healthcare system in cooperation with the government. I would always tell that any activity, CSR activity in the health sector, should be with the cooperation of the government, so that whatever is done in this sector becomes sustainable. So if we were to design some CSR project regarding health, we should involve the government officials, government doctors, government healthcare department, and then design programs, so that after the donation is over, after the donor or the corporate exits from this activity, this would be continued by the government department, the health department, or the hospitals concerned. So when I was in SBA Foundation, we used to insist that whatever projects we are doing, it should be like in supporting government hospitals, and also the doctors, healthcare workers there should also agree that after we exit, they will continue these activities, that they will become the owners of these assets and continue it. So here we can, apart from involving the government officials or doctors, etc., we can also involve the local panchayats, etc., so that community leaders, local panchayat, etc., so that whatever activity is being done, its maintenance, etc., will be taken care of by the, or owned by the community, by the hospitals, and it will continue. So only in that way only we can make activities sustainable. So that's as regards infrastructure. But then be it diagnostics, treatment, in all these areas, lot of disruption have to take place, and corporate social responsibility can play a big role. See, not every patient cannot be accommodated in hospitals or taken to hospitals for basic treatments and all, like knowing what is measuring the BP or the blood sugar level and all. If everyone rushes to the primary care centers and all, it would be a big strain. Therefore, what I would suggest is that we should have micro entrepreneurs in the health sector, where this will also provide employment to many people, as well as also a facility for people around that enterprise to go for minor ailments, like finding the blood sugar level, or having a blood checkup or body checkup. Minimum things can be done in these micro health enterprises. And then if these whatever is collected there, information collected there, can be sent to the secondary or tertiary level hospitals or district level hospitals, so that our primary basic health centers are not overloaded or stressed. So this is something which innovative idea which I am having in mind, is that micro health enterprises should be there in all the villages, or even in urban centers also, so that people can go there and address their basic health requirements. Also, we should use telemedicines in a big manner. It's not much popular in India, but then it should be like popularized, and corporate social CSR support should come in these areas. Because if you are able to use technology, digital technology, etc., in the healthcare sector, it can be scaled up, and it can also cover a large number, large population. Otherwise, everyone would have to rush to whatever hospitals they are having, and it will overload, strain, stress the hospital infrastructure. We have seen that during COVID also. So corporate social responsibility funds can be directed towards bringing innovation or creative changes in the healthcare system. Infrastructure, of course, we require. Their CSR funds can go. But apart from that, activities like promoting micro enterprises, where a good number of patients can be sent, or in encouraging telemedicine, or whatever innovation is possible. And also I would tell even research. Also CSR funds can help support. I will conclude by telling that CSR activities are being promoted by the government so that private sector involvement is there in addressing the development challenges. And health is one major development challenge which we have to address. And here, corporates should come out with innovative, creative programs so that this can be addressed on a large scale and it will also be effective. The money is there, both with the government also, with the private sector also. What we require is intent to bring a disruptive change in the healthcare sector. Thank you.
Thank you so much, Mr. Nixon Joseph, for joining us today and explaining the importance of developing sustainable health infrastructure under CSR. And as you said, we have a lot to do compared to other countries, and government has its limitations. And rightly said, it is only through public-private participation we can achieve the 2030 agenda. Thank you once again for joining us today.
Thank you very much. Thank you. Thank you.